Welcome to the Novant Health Bariatric Solutions online information session. My name is Dr. Ellen Carraro, and I will be briefly reviewing both our surgical and non-surgical options. Bariatric Solutions specializes in the medical and surgical management of obesity. We provide a multidimensional approach for lifelong weight control through nutritional, psychological, exercise, pharmaceutical, and surgery approaches, supporting our patients at every stage of their weight loss journey. The goals of this session are to introduce our team and our approach, to discuss our medical weight management options, and overview surgical considerations, including candidacy, benefits, options, and our pathway to surgery. Our team is composed of 3 board-certified general surgeons, each of whom are fellowship-trained in advanced minimally invasive surgery and bariatric surgery. Dr. David Vollinger, Dr. Craig Kolash, and myself, Dr. Ellen Carraro. Our team also includes an exceptional group of physician assistants and nurse practitioners who each provide pre- and post-surgical care, as well as ongoing care with our medical weight management program. Unique to this practice, our behavioral health team, as well as our registered dietitians, are all under the same roof, and we work closely together to meet the individual needs and concerns of our patients and offer collaborative plans to maximize our patients' outcomes. At Bariatric Solutions, we believe in a truly multidisciplinary approach. The disease of obesity is very complex and involves a multitude of medical, behavioral, environmental, and metabolic components. Our medical weight management program is a non-surgical program that is founded on evidence-based medicine approaching weight loss. We provide an individualized approach to lifestyle management and behavioral counseling and use a variety of medicines and additional supplements when deemed appropriate. This program allows for ongoing monitoring, goal setting, and evaluation, including care from our nutrition and behavioral health teams. For those considering a surgical approach, our first step is determining if you are a surgical candidate. Body mass index, or BMI, is a calculation of height and weight. You must be found to have a body mass index of 40 or greater, or between 35 and 40, with a related medical problem, such as high blood pressure, diabetes, obstructive sleep apnea, or elevated cholesterol. You must also demonstrate that you have tried alternative weight loss options, have an acceptable operative risk, and are willing to participate in our comprehensive weight loss program. BMI calculators can be found online, or charts such as this can be used to determine your BMI. First, you find your height along the left. Then you identify your weight along the top. And your BMI is the number where the two intersect, as seen here. There are some limitations that may exclude you from being a surgical candidate. First, you must be deemed medically appropriate for general anesthesia. Smoking or use of any nicotine or marijuana products is not allowed. A minimum of 3 months of nicotine and THC-free is needed to be a surgical candidate. Active alcohol or drug abuse or addiction would prevent one from being a surgical candidate as well. Possible limitations include prior stomach surgery and not demonstrating compliance with our program. Why would one consider bariatric surgery? The benefits of metabolic surgery and weight loss are plentiful. Surgery improves health and resolves many related medical problems. The image on the left lists several related medical issues and their rates of improvement or resolution. These health improvements also reduce healthcare costs. The risk of not treating obesity and the related medical problems are found to far exceed the risk of surgery for most individuals. Additionally, bariatric surgery has been shown to improve longevity. In fact, a study in 2023 estimated an increased median life expectancy after bariatric surgery of 6 years. This graph shows the increased survival in both diabetic and non-diabetic patients who undergo bariatric surgery versus those who did not have surgery. So how do these bariatric surgeries work? Each procedure works by combination of 3 mechanisms. The first is restriction. The stomach size is reduced, which allows a much smaller amount of food to give the feeling of fullness. Second, some of the procedures have a component of malabsorption. This means that the digestive system is rerouted, which reduces the amount of calories absorbed by your body. The third mechanism is hormonal in nature. Hunger and fullness pathways from the brain to the stomach are changed, leading to early sensation of fullness, decreased hunger signals, and the development of preferences for healthier foods. There are several surgical options which we will outline briefly, and you will discuss in more detail if appropriate during your consultation. The first surgery is the vertical sleeve gastrectomy, commonly referred to as the sleeve. In this procedure, approximately 75% of the stomach is removed, which results in significant restriction as well as decreased brain signaling of hunger. This straightforward surgery is often performed as a primary surgery, but also may be paired as a staged procedure for those with very serious obesity. Advantages of the sleeve gastrectomy include a very low complication rate and fast recovery time with minimal long-term complications. The expected weight loss is approximately 60 to 70% of excess body weight. Notably, this is a non-reversible surgery and may not be appropriate for patients with baseline GERD, as reflux may be worsened by this procedure. Next, we will discuss the laparoscopic Roux-en-Y gastric bypass. This procedure utilizes all three mechanisms of action: restriction, malabsorption, and adjusted brain signaling. A small portion of the stomach is separated, which is the only part of the stomach that holds food again. The small intestines are rerouted, so greater than 100 centimeters of small intestine are not being used for calorie absorption. The average weight loss with a bypass is 70 to 80% of the excess body weight. The surgery is an excellent consideration for those with heartburn, as it's often improved after this procedure. It is also a great tool for long-term management of diabetes. Risk profile is higher than that of the sleeve gastrectomy, and this may not be appropriate for patients with a history of nicotine use, heavy alcohol, caffeine, or anti-inflammatory medicine use. Nutritional supplementation is higher due to the malabsorptive component of this surgery. Biliopancreatic diversion with duodenal switch. This surgery is not a standard first-line option, but may be discussed on a case-by-case basis when appropriate. It combines creation of a small tubular stomach, similar to the sleeve gastrectomy, with rerouting of a large portion of the small intestine, creating restriction, malabsorption, and brain signaling adjustment. While the duodenal switch provides an average weight loss greater than that of the other surgeries, with favorable changes in regards to many medical problems, including diabetes, it has a significantly higher risk for vitamin and mineral deficiencies and other serious risks, as well as a quality of life consideration that will be discussed with your surgeon. Next is a laparoscopic adjustable gastric band, or lap band. This procedure entails placement of a silicone rubber adjustable band around the upper portion of the stomach, creating a much smaller pouch above the band. This procedure provides restriction but no malabsorption and does require adjustment by accessing a port which resides under the skin on the abdominal wall. This is seldom performed as a first-line surgery currently, but continues to be used in specific circumstances. The lap band can result in up to 50 to 60% of excess body weight loss, which occurs over a slower period of approximately 2 years. While recovery is quick from the initial surgery, it does require multiple adjustments and has a risk of several complications as noted. An additional non-surgical offering is an endoscopically placed or Bara intragastric balloon. This procedure includes placement of a fluid-filled balloon in the stomach for 6 months and produces an average of 3 times the weight loss than with exercise and diet adjustments alone. It is not covered by insurance. Qualifications to be a candidate are listed in the bottom of this slide. For those who do qualify for surgery, the process or pathway from initiating our program until the day of surgery averages between 3 and 6 months. The components of the workup and preparation are detailed here. The journey starts with scheduling an initial consultation, which is an individualized evaluation with the provider in our office to assess your candidacy and review specific surgical options, determining which is the best surgery for you. After this visit, you meet with multiple team members working to prepare you for the lifestyle changes needed to be successful. Meanwhile, we medically evaluate you with the help of your primary care provider and possibly other subspecialists if necessary. After the pathway has been completed, we obtain clearance from your insurance and schedule surgery, as well as post-operative care to continue our pathway and guidance after surgery. Our dietitian's role in your weight loss journey is fundamental to making healthy nutritional changes that will support your goals. They assess your nutritional and health needs, counsel on eating habits, assist developing meal and nutrition plans, monitor your progress, and continue to provide resources and education into the postoperative phase. Our behavioral health team focuses on teaching you how to change your relationship with food, addressing issues such as eating related to emotion, boredom, stress, anxiety, and depression. They help recommend new strategies to help change habits, focus on mindfulness, and prepare you mentally for the changes that occur with bariatric surgery. Insurance coverage for bariatric surgery can be unclear. We do accept all insurance carriers covered under Novant health contracts. Our staff assists in verifying insurance policies prior to your initial consultation, but occasionally there are times when we need assistance from the patient. We recommend that each patient contacts his or her insurance company, specifically the customer service phone number on the back of your insurance card, and ask the questions listed here. If bariatric surgery is excluded from your insurance's plan, you are considered a self-pay patient. The average total costs for surgery, hospital fees, and anesthesia for each procedure are listed below. We hope that this information has helped you understand our goals, options, and philosophy, and that you are eager to start your journey towards a healthier life. Call our office at 704-316-7760 to schedule your consult today.